Hello, welcome to Nature Source Care. This is Dr. Fonda Goldman. I'm a licensed naturopathic physician, and today I was going to talk about Marma therapy, specifically the Ayurvedic energy points on the lower abdomen. Note of caution before we get too far along. The information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. It's always important to determine the root cause of any disease and to develop a comprehensive treatment plan. Individual cases can vary in terms of treatments that are most effective, and solo therapies may not be appropriate or effective in all cases. So using Marma therapy by itself may not be appropriate or effective. It might need to be combined. It's best to combine it with other therapies. So a bit about Marma therapy and its background. It comes from Ayurveda, which is traditional Indian medicine. Ayurveda is more than 5,000 years old. I really appreciate Marma therapy and the fact that it's non-invasive. Some people like to call it Ayurvedic acupressure. If you've ever wondered, acupressure and Marma therapy again come from two different traditions. Some of the points are exactly the same. Some of the points have some overlap, and some points are completely different. So they are actually two different systems. In Marma therapy, it's considered an energy therapy. So it's an energetic paradigm that we're working from. There are 107 Marma points on the body. And so since we're working with an energetic paradigm, you want to try to start thinking about people, diseases, and states of health as different kinds of energy or waves. So, all you're really doing here is using gentle touch to allow the energies to rebalance themselves at these points on the body. So pushing harder, pushing longer, more often, that sort of thing, is not necessarily what somebody needs. So that kind of thought process, that's more of a biochemical or biomechanical thought process. So again, you don't need much here, you don't need long here. Most of these points you only work with for 30 to 60 seconds. So it doesn't have to be intense and long and uncomfortable for it to be effective. It's actually very gentle. So if you're interested in more history on Marma therapy, I would check out my first video, Marma Points on the Hand. If you want an example of how to work with the points, I also created a Marma Points on the Hand follow-along video, which you can follow along and do a Marma session on your own hands. And this is Marma therapy points for the lower abdomen. I've created abdomen videos, Marma points on the upper abs and the middle abs. So this is the third in the series, and we'll complete the front of the torso, And if you're interested in more content like this, I would check out my Marma therapy, Ayurveda, and body care playlists. I always organize my videos into playlists so that they're easy to find. So we have 4 new points today. The first one is called Basti, which in Sanskrit translates to bladder or enema. And where is it? It's in the midpoint between the umbilicus, which is Nabi, if you watch my middle abs video, Nabi. And it's the other endpoint is the superior border of the pubic symphysis, or the pubic bone, which is called Bhaga, and I'm going to talk more about Bhaga on the next slide. So basically, it's the midpoint between your belly button and your pubic bone. That's where Basti is. You can see in the photo here. The energies that this point balances are Apana-vayu, Vyana-vayu, Ranjaka-pitta, and Kledaka-kapha. So I'm not going to go explain all these different energies. I'm probably going to do more videos on these energies. But if you're familiar with Ayurveda, this will help you kind of understand the energy dynamics of this point. Just as one example is Apana-vayu. Apana-vayu is wind, and there are 5 different kinds of subcategories of wind energy. And Apana-vayu is the downward movement of things in the body, and especially in the pelvis area where we're working here. We're talking about urination, defecation, also delivering a baby. The downward movement of things. That's the Apana-vayu. Okay, so if there's issues with, again, downward movement of things like regular menses, right? There would be difficulties with a regular downward movement of things. Then this point is good for regulating that energy. So as I mentioned before in my other videos, all Marma points have local effects. So this point is good for local pain, circulation, and function of pelvic organs. And again, the Apana Vayu, this point is they're all good for Apana Vayu, the ones I'm going to mention today, but this one especially. And again, whenever there's an issue with elimination, this is generally a good point to work with. And since it's local, you might guess that this point is also good for urinary problems. So problems with the bladder like tone or function, cystitis, urethritis, urinary tract infection, frequent urination, urgency, enuresis or bedwetting, incontinence, retention of urine, burning, inflammation, pain. So almost any kind of condition related to the urinary tract can be helped with this point. And also, as you can imagine, since it has local effects, it also helps with sexual function, especially for women. So painful menses, pelvic inflammatory disease, and fibroid tumors can be helped with this point. All right, so that's the first one, Basti. The second one is Bhaga, which translates to sexual pleasure in Sanskrit. I had to get creative with how I diagram the photos so I don't get censored by YouTube. But basically it's the midpoint of the superior border of the pubic symphysis or the midpoint upper border of the pubic bone. And the energies, it's actually the same energies as Basti. So Apana Vayu, Vyana Vayu, Ranjika Pitta, and Klinika Kapha. And as you can imagine, since this is so close to the external genitalia, you only want to work on this point on yourself. You don't want to do this on other people. Even as a practitioner, you can describe it, but don't do this point, obviously, especially for somebody who has a history of sexual abuse or sexual assault. It's going to stir up a lot more than you probably want to deal with, and that's appropriate. So, again, local effects, so pelvic circulation, function, pain, fullness, and distension, any of these kind of issues in this area of the body. And again, the urinary tract, bladder dysfunction, retention of urine, enuresis, urethritis, frequency and urgency of urine, difficulty urinating. So again, the whole urinary tract. And then reproduction. So both male and female in this case. So for men, prostate dysfunction, impotence, for example. And for women, dysmenorrhea, irregular menses, ovarian disorders, and pelvic inflammatory disease. And for both men and women, or people in between, right? It's easy to get caught up in a binary system when it isn't, in fact, in nature. So, but anybody experiencing painful sex or coitus, low libido, working on this point can be helpful in that regard. The other thing is this is very close to the first chakra, or Muladhara chakra, and this area is where, in, for example, yoga, the yogic paradigm, there's a sort of trove of energy here, kundalini energy, that's important for really human, personal, and spiritual development. So this kundalini energy can be very sexual in nature. So working on this point can stimulate sexual energy. And the other thing is that it can, well, how do we say this? So again, in the Ayurvedic system, having a lot of sex can actually deplete you energetically. Yeah, and it can deplete what they call ojas. Ojas is a sort of finer, subtle substance that sort of is the nourishing juice of the body, mind, spirit. So it's kind of what gives you that glow when you're in, good harmony and balance with yourself and the universe. It's also responsible, this ojas, subtle fluid is important for your immunity. And so if you overextend yourself through sexual activity or other activity, you can deplete your ojas and basically deplete your immune system as well. And so in that regard, sometimes when somebody's really depleted or overwhelmed or something like that. Ayurvedic practitioners will suggest for people, if need be, to kind of hold back on sexual activity a bit, so that their ojas can be restored. Yeah. So it may seem opposite, but it's actually related to this, is that this point is also important for spiritual energy. So again, this Kundalini energy, it's really, it is just an energy. And so it kind of depends on, like, what do you want to do with it? Yeah, it kind of exists in the root energy. And if it stays in the lower area of the body, in the pelvis, then it's mostly comes through, it mostly manifests itself as sexual energy. But if you work through different sort of yogic practices to move the energy up the spine, up to the crown chakra, then that energy that was sexual in nature can actually be transformed into more of a spiritual energy. And so for some people, some yogic practitioners, they may want to limit or control their sexual activity, not just because of their constitution. So in Ayurveda, there are 3 constitution types. You can check out, I've done nutrition videos on all these types, but there's basically people with too much wind or vata, people with too much fire or pitta, and people with too much earth or kapha. Yeah. So kapha people, since they're earthy, they're going to be the most stable. And kapha people actually can have the most sex, basically, because they're so stable that they don't get depleted as easily as the other 2 types. Fire people, pitta people, they're kind of a moderate level, and so they're not advised to have as much sex as kapha people, but they can have more than vata people. Vata people tend to be the most sensitive, they tend to be the driest, they tend to be the most overactive because they're like the wind, they're always moving. And so they kind of, through this nervous energy and, restlessness, they deplete themselves. Not just sexually, but generally in life. And so they're suggested to have sex on a limited basis, maybe once or twice a week, so that they don't deplete themselves and they don't deplete their ojas of immunity. But in any case, some yogic practitioners may choose to become celibate or diminish their level of sexual activity so that they can work on bringing this kundalini energy up the spine to the crown chakra so that it manifests more as spiritual energy in their lives. And so ultimately, from a yogic perspective, working on this kundalini energy is one way of mastering desire. And, we can get into this whole kind of large concepts about, mastering desire generally, not just sexual desire, but the desiring mind, because it's really the desiring mind that, whether it's you want a piece of cake or you want a new sweater or you want, the hot new person that showed up in the office today, the desiring mind can get us into trouble and kind of take us off path if we're not mindful of what we're doing or where it's taking us. There's a lot here besides just the physical medical issues that can be balanced through this second point of Bhaga. The third point is called Lohita, which translates to blood in Sanskrit, and it's on the medial side of the ASIS, or the hip bone. So there's one on each side, and the energies, similar to the other 2, are Apanavayu, Vyanavayu, Ranjaka Pitta. So the indications here, again, local, so the lower abs, hip, pelvis, even colon, because again, it's kind of on the side, so you'll get both sort of more frontal aspects and dorsal aspects that'll be local to this point. Also lymphatic drainage and distension. This point's interesting because it actually regulates blood and circulation in the lower extremities. So things like hypertension or high blood pressure, thrombophlebitis. It's also related to the femoral artery and nerve and the heart. So it's kind of unusual. You wouldn't suspect that it would have that much to do with the blood and circulation, but it's very important. And you can use this point if you're working on blood and circulation generally, as well as the Hrid Marmani. And if you remember, if you saw my chest video, I went through the Hrid Marmani in the chest video, which are obviously close. Hrid means heart. So the heart Marma points. But especially like the blood and circulation in lower extremities can be helped with this point, so right on the hip bone there. And then because of the local effects and the circulation effects, then when you put these two together, different things that can show up in the lower extremities, such as circulation problems, edema or swelling, because again, there's not good venous return to the heart, numbness and coldness because there's not enough peripheral circulation to keep the tissues warm, neuropathy because the nerve cells, nerve endings, in your toes or your feet aren't getting good fresh blood and to feed them well, basically support them, and then also inflammatory markers are not getting swept out of there through good peripheral circulation and peripheral vascular disease. All these sorts of things can actually be helped at this point, which is pretty amazing actually. And then female menses, so irregularity and painfulness and even a disappearance of menses can be helped with this point as well. So lohita right here on the hip bone. And the fourth or final point today is called Vakshana, which means groin or joint of the hip in Sanskrit. And it's in the midpoint between Bhaga, which we just talked about. A couple slides ago. Yeah, the pubic bone. Excuse me. So between the midpoint of Bhaga, the pubic bone, and Lohita, the hip bone. So that's where you're going to find Vakshana. Yeah, so between the hip bone and pubic bone. There you go. On both sides, obviously. And then the energies here are going to be the Apanavayu, Vyanavayu, Ranjika-Pitta, and Klanika Kapha. So again, all Marma therapy points have local effects. So things like pelvic circulation, congestion, inflammation, pain, fullness, distension, and early stages of an inguinal hernia. Again, if it's really advanced, you probably don't want to be working with this point. But also urinary issues. So issues with the bladder sphincter, urinary dysfunction, retention of urine, bedwetting, enuresis or aneurysas, same thing, different terminology. Urethritis, frequency, urgency of urination, difficulty urinating. So again, the urinary system in its completeness. And then also reproduction again. So for men, prostate function, testes, spermatic cord, impotence, premature ejaculation, spermatorrhea. For women, leukorrhea, dysmenorrhea, urine pain, irregular menses, ovarian disorders, fallopian tube disorders, and pelvic inflammatory disease. And then again for both men and women. And, again, we're talking more medically here, more than gender identification. That's, we would consider that a different thing, although it's completely important. And, again, there are people who literally are born in between being male and female. So, but yes, it's hard to, I guess, with the current medical system, hopefully the medical system terminology advances with sort of the consciousness of society, I guess. In any case, for everybody, working on this point should help with low libido and painful sex. Again, depending on what's going on here. So I mentioned in the very first video in the disclaimer that you got to know what's going on. So working on these Marma points is not going to be helpful, is not going to be entirely appropriate or effective if you have a raging STD. Like you probably have to go get some antibiotics of some kind, yeah. So, but the Marma therapy in conjunction with the antibiotics can be helpful. Yeah, so again, just keep that in mind. Marma therapy is one tool in your toolbox. But hopefully part of a complete treatment plan. So just to summarize, the lower abdomen points, again, local effects for all of them. The Apanavayu or elimination energy is mostly controlled by, it's balanced by all of these, but the main point here is number one, or basti, between the navel and the pubic bone. Urinary dysfunction, basically 1, 2, and 4. The hip bone may not be as helpful, again, because it has other functions. reproduction, all of them, sexual energy and spiritual energy, again, it's that bhaga point, right above the pubic bone, blood and circulation, and the lower extremity, again, that's the special point, lohita, or the hip bone. Yeah? So, just 4 points a day, and it seems like they're fairly simple, but there's actually some very profound effects from these points. And just a few additional words on how to work with these points. So again, you can just gently press your fingers or lay your palm of your hand on these points. And again, you can check out my Marma hands follow along video if you want an example and follow along experience. You can also take a warm or cool cloth, again, and just gently lay it on these points. This again depends whether it's warm or cool, depends on whether we're dealing with a vata, pitta, or kapha situations. So is it too much wind, fire, earth? You know, that depends on somebody's constitution as well as the current symptoms that they're presenting with. So that gets into more of the sort of diagnosis. But if you know what you're dealing with, then, you know, using warm or cool, you know, wet cloth can be helpful. Also, Abhyanga, so warm oil massage, that's a huge part of Ayurveda. It's on my list of other videos to make. I haven't made one yet. But I have made a video on natural oils and the Ayurvedic energetic properties of them. So if you want some information about how to choose which oil to use for warm oil massage, I would check out my natural oils video. You can also do something simple. So if you're having pain or distension, fullness in the lower abdomen, it's not usually very comfortable. Like sometimes you can't, you know, sit in a chair because just folding your legs like that puts pressure on the lower belly, and that might be too much. But you can do something like lie on your side in the fetal position. And when you do that, you're going to be lying on your hip bone or lohita point. So that may be why people instinctually, when they're not feeling well, especially in their lower abdomen, do that. You know, they lie on their side in the fetal position. So there's actually some, you know, energetic support for that natural instinct. The other thing you can try, if it's not too much, if you're not too sensitive with whatever's going on, you can try lying on your stomach with a thin pillow under your chest. So you're just lying on the floor on your stomach. If you put a pillow under your chest, it's going to lift up your chest, and it's going to create like a slight back bend. Yeah. And it's going to put a little bit of pressure, not too much. You don't need to really prop yourself up high, but if you just, you know, take a small pillow and it pushes your chest up a little bit, that'll put a little bit of pressure on these points. And if you just kind of stay there and take deep breaths, that can actually help potentially. You know, again, if it's too uncomfortable, that's not the right way to go for you. You might need some other things. And again, this may not be appropriate if you're pregnant to lie on your stomach, so obviously, so keep that in mind. There's also, you know, different sorts of yoga poses and things that you can do. So something like Sufi grind, where usually somebody's sitting in cross-legged position or in a chair, and then what you do is you sort of pull your chest forward so that your spine comes forward, and then you kind of rotate clockwise a few times. So your spine goes front, you know, side, back, side, front again. So you're just creating a little circle, but with your spine. It's almost like your spine is like a spoon and your pelvis is the bowl. Okay, so you're just sort of stirring the spoon and in the bowl. You're moving your spine so that you're going to stretch basically the ligaments and tendons near these points. And then you can do it a few times one way and a few times the other way. I used to do that when I was teaching prenatal yoga. The women really loved it. Sometimes they told me they would come back and tell me that, you know, they were like sitting in the car and getting uncomfortable, and so they'd start doing this, and it made them feel better. Because essentially what they were doing was stimulating or rebalancing the energy points. Yeah. And then also, you don't even have to do physical things necessarily. These are all physical things I mentioned so far, but you can just do meditation and breathing. So you can just think about your hip bone, you know, visualize it in your head and breathe and send your breath to your hip bone or your pelvic bone or, you know, the Vangshanam point, whichever one you want to work on. And just bringing awareness, because again, you're going to bring that kind of I was going to say ethereal, but it's more like your ethereal body, your astral body, like your more subtle energies you're going to bring to this point, or whichever point you're working on, and it's still going to help on some level. So you can try that as well. Yeah, so again, just different ways to work with these points. So there you go. We finish up the abdomen with this third installment of the lower abdomen points. So far, the videos I've created are Marma therapy. We've covered the head, face, neck, ears, up the whole arm and hand, and the whole front of the chest. So next time around, we'll start working on the back side of the torso. I hope you're doing well. I hope you're working on these points and learning them and using them when you can, and that the information and experience is very helpful to you. Thank you for your time, and until the next one, take care. Bye-bye.